Welcome to another edition of Thankful Thursday, and I'm so fortunate to be joined today by Associate Professor Jeffrey Painter and Dr. Zara Booth Mason, both 30-year veterans of the Sydney Adventist Hospital, assisting us in the area of ophthalmology. And we are entering a collaboration where the SAND Foundation is going to be enabling our community to support some really important research in macular degeneration. My understanding is it's becoming the #1 cause of blindness in the demographic that we serve here in the Upper North Shore. Almost everyone knows someone, or it may be a relative or a friend affected by this debilitating disease. So it's actually such an honor to support this work, and we just wanted to give you a chance to share with our community the basis of the work and some ideas of the impact that we hope that this is going to have. Thank you, Dr. Painter.
Thank you very much for inviting me here today. It's a great privilege to be here with you, Judy. We're very honoured to be part of this research project. The research project grew out of a collaboration between the Sydney Adventist Hospital and Australian National University as part of their Australian National University Clinical School, which treats medical students. They're very big on research, and their major research project is linked to eye health, and they've chosen the Sydney Adventist Hospital to look into macular degeneration. And as we're hearing, macular degeneration is one of the leading causes of visual disability in our society. It's more a disease of the older age group, but it can affect people even as young as in their 50s and 60s, and it can be very debilitating. It can cause loss of independence, it can cause loss of ability to drive, loss of ability to read, loss of ability to do one's financial affairs. Thankfully, it doesn't rob you completely of your sight, unlike diseases like glaucoma, but it can make one's life very much more difficult. And this is what we're here about, trying to find out the cause of it, because when one finds the cause of it, one can then do something about it and possibly develop a treatment. We've been looking to the cause for many, many decades now, and so far, apart from some genetic links, we haven't been able to find why people get macular degeneration even in the earlier years, and why I've got 90-year-olds who have no macular degeneration. What we're looking at is a particle, and they're called in the messenger RNA area, and we're looking to see if there's a link between that and various stages of macular degeneration, and what that link looks like as the macular degeneration progresses. We're part of a multi-centred trial. We're very honoured at the SAND here to be associated with a number of very eminent research bodies in Australia, and the work is going to be done at Gordon Eye Surgery, where Sarah and I are some of the principals, and we have large numbers of patients with macular degeneration and a number of macular degeneration experts, in fact. So that's why the SAND has picked us, because we're well placed to be able to recruit patients, and also our patients have done research projects in the past and are very used to research, and would be very able to help, I feel. But the help from the SAND Foundation has been very helpful, because of course one needs funding to pay for equipment and research people to help with the research, and we're very grateful to be able to talk with you today, and very grateful for the SAND's help in promoting this research project, which is so important to improve maybe not this generation's quality of life, but certainly the next generation's quality of life, if we can find a cure for this terrible disease.
Thank you so much, and again, it's such an honor to support such important work. And Sarah, I was quite heartened to hear about the impact that medical research had on glaucoma over time. So I think it'd be great if you could share that with our community, what that series of events is, and hopefully we can apply that same methodology over time.
Yeah. So when I first started, which was a long time ago in ophthalmology, glaucoma was the commonest cause of blindness in middle-aged and elderly people, and quite profound blindness as well. But medical research has really turned that around. And there's still ongoing research as well to try and improve things. And again, this is a disease that has genetic elements as well as aging elements and also unknown elements. But early screening, early treatment, better targeted treatment has made a huge difference to the outcomes, so that now macular degeneration has taken over as the big cause of visual disability, as Professor Painter was saying. And I think that this research has really shown some very exciting potential, which we haven't had for a long time in that dry macular degeneration spectrum. So it will be certainly something that we'd love to support, and with help, obviously, that will make life a lot easier to push this research project along and hopefully deliver what we hope it will deliver.
Well, thank you again for your time today. Thank you for approaching the SAND Foundation. We welcome any partnership or collaboration that's going to amplify the impact we can have in our community. So we look forward to hearing about the progress of your work.
Thank you.
very much.
Thank you very much.